Hi, everyone.
Happy Veterans Day weekend. We just want to thank everyone who has served. I actually spent 10 years in the Army, actually a total of 16 with the reserves. And today, we want to talk about the one thing that you must avoid if you want a healthy brain, and that's a traumatic brain injury. As some people know, my new book, Memory Rescue's out Tuesday, so exciting.
It's actually an awesome book.
Well, thank you. We have been doing a series of live chats on Memory Rescue, going through the 11 major risk factors that steal your mind using the Bright Minds mnemonic, and the H in Bright Minds is head trauma. But today, I am blessed beyond belief because I actually get Tana, and she's my podcast partner, my life partner, my boss most of the time.
No, don't believe him. Do not buy it. But I want to, because it's Veterans Day weekend, it's like totally apropos. Can I tell Denny's story and then you talk about how that sort of turned out and I just think it's so appropriate for what we're talking about today. Can I talk about that?
Well, I said you were the boss.
See, maybe he's right. So it's not really true though.
Hello, Atlanta.
So I was at a survival training weekend with Chloe. I took my daughter to go to this weekend where we did this survival training. I'm still not totally recovered. My hands are still a mess. It was kind of crazy, but it was really fun. It was out in the wilderness, and it was pretty brutal. It was actually pretty intense. It was fun though, great bonding experience. But one of the instructors are a lot of ex-military. There's a fireman. There's they're really good guys. They're really nice guys. And one of the guys who was an ex-Marine just had a heartbreaking story. And so I thought this was so appropriate. So his story just gripped me, right? So I invited him to come down and tour the clinic, and he ended up getting a scan. And he's only 30. And he's a really young guy. His name is Denny. And he was in his truck with 3 other guys, and they were his friends. I mean, besides, being in the Marines with him, they were also his friends, as often happens. And they were blown up. And so 2 of his best friends were
way too often.
Right. And so 2 of his best friends were killed. The other one, I don't remember exactly what it was, but it was very terrible, what happened to the other one as well. And he suffered just massive injuries, massive head trauma. And he just went down this rabbit hole, basically of hell, just with the care, he was in surgery, and he was, I think at one point he went into a coma, and he had, it was crazy.
He had 3 head traumas, actually was unconscious on 3 separate occasions. So, he got whacked really hard.
So it was pretty bad. This was a really bad experience. So he got a scan, and it was really interesting. So here are these Marines, and they're trained to run into the worst scenarios, right? They're conditioned, and they are taught to be incredibly brave, and we're eternally grateful for the service. And they run head first, just straight into the worst scenarios, basically to protect, our rights and what we live for. And when he came into the clinic, he was like a nervous wreck, and he was terrified. And he told me, he was very open and very vulnerable and raw, and he was very honest. And he said, I am terrified of what I'm going to see on my scan, because he's had 12 concussions, and he's had 3 traumatic brain injuries, and he's honestly been through hell with his medical care. And besides the surgeries and everything else, he ended up basically suicidal and actually attempting suicide. He told a story on a live chat on my page. And so it's really awful. It's just really, really sad what he's been through. So he's been through this crazy amount of care, and just layered with medication, never felt like it was getting better. And so he was just terrified. He just figured it was going to be the worst possible thing that you could see on a scan. So I asked my husband as a favor, maybe I have a little bit of bossiness in me. He was getting back from the White House speaking that day. I'm like, I just need you to look at one scan, because he doesn't see patients anymore. And so
I have a whole bunch of patients.
I know, he doesn't see new patients. So I'm like, I just need you to look at one scan and meet this guy. And so it rarely happens. And so he just does a favor to me, looked at it, and it wasn't, Denny was relieved. Because, and this is what we see a lot of times, it wasn't as bad as what...
Oh, no, it was bad.
It was, but it wasn't as bad as what he thought based on what he had experienced and lived. But it explained his life perfectly.
Right, he had low activity in his frontal lobe. So 94% of people with brain injuries have frontal lobe issues. So forethought, judgment, impulse control, planning, empathy, learning from the mistakes you make. I mean, it's just a critical human function. He also had temporal lobe problems, mood instability, temper problems with learning and memory. So temporal lobes are underneath your temples and behind your eyes. He had occipital lobe problems in the back. And so, your brain's in a closed space, your skull. And so if you get blown up, it shakes and you can hurt the front, the back, the middle where the temporal lobes are. But we have a program on my computer that I can actually see how much better can it get. And
that's what gave him hope. And it was so exciting.
It can get so much better. So someone's asking about the type of scan. At Amen Clinics, we do a study called Brain SPECT, S-P-E-C-T, imaging. And SPECT is different than an MRI and a CAT scan. It looks at blood flow and activity. It looks at how your brain works. And so his MRI may have been normal, but you can clearly see how the function of his brain was not normal. But in the program we have, we could see with the right thing, it can be normal, and that's so important.
But talk to me about this, because this is really interesting. So he went in to get treatment, right? They knew he had a head injury. They knew he had a traumatic brain injury, and they were treating that with layers and layers of medication. But what you saw also was pretty severe PTSD, the anxiety in his brain and the emotional trauma, and they weren't treating that. And so tell him the problem with that.
Right. Too often when people have something, so traumatic happen, like a traumatic brain injury, you get labeled with that, and people aren't paying attention to the emotional trauma of seeing your buddies being blown up, of having a major loss of function. And in the scans, and we have published this in scientific journals. In fact, Discover Magazine listed our research as one of the top 100 stories in science for 2015, is we can separate, is it TBI, traumatic brain injury, or emotional trauma, post-traumatic stress disorder, or, like in Denny's case, is it both?
And a lot of times it is, right?
For him, it's both, and they are treated separately. They're treated in a different way. Someone's wanting to know the closest clinic to Chicago. We have a new clinic in Chicago, in Bannockburn up by Highland Park. So we're very excited about that. And, what we get most excited is not being able to show him the picture of his damaged brain, but to fix it. And in order to fix it, so that's what Memory Rescue is all about. It's how do you put your brain in a healing environment? And the idea behind Memory Rescue is if you want to keep your brain healthy or get it back if you think it's headed for trouble. We do have an office in the Bay Area in Walnut Creek. So if you want to keep your brain healthy or get it back if you think it's headed for trouble, you have to prevent or treat the 11 major risk factors that steal your mind. And head trauma is the single most important thing you need to avoid if you want to keep your brain healthy.
And yeah, I mean, it's just it's amazing when you see that sigh of relief on someone. And especially, I just have a soft spot for veterans. I mean, I truly cherish our warriors and what they do for our country. And my husband giving 10 years of his life to the military, and it's a sacrifice, and we need to do better than throwing our warriors pretty much away when they come back. And
or throwing multiple medications at them and then not telling them you have to put your brain in a healing environment. So the foods you eat matter. Tana's got a great new cookbook called The Brain Warrior's Way Cookbook.
Because I love warriors.
Particularly important for veterans, right? And we both believe you're in a war for the health of your brain. Nowhere more true than for veterans.
No, and just like you behave like a warrior, for other things in your life or for our, other things we believe in, you've got to be a warrior for your brain and body, especially for your brain, because it literally controls the quality of your life in every other way. So
in every way. Your brain's involved in everything you do. So on this Veterans Day, shout out to all the veterans. And, the most important thing you can do is love your brain. So over the next week or so, I'm going to finish Bright Minds. So we've talked about B for blood flow, R, retirement and aging, I is for inflammation, G is genetics. Today we're H for head trauma. And my dog, I love my dog. So Aslan is just awesome. But
wait. Aslan, say hello. Say hi. Say hi. Okay. Anyways.
So I love my dog, but he doesn't understand that if I'm not here, he's not going to eat as well. And because he leaves his toys everywhere. Go downstairs, there's his toy. So it's really important to not text while you drive, to turn the lights on before you walk in a room and you don't know what's going on.
Yeah, it's one of the major problems I'm a nurse, and so in the hospital, they call it a fall risk, right? So the elderly are fall risks, and we have to be very careful. And one of the first things is just teaching people to make sure that all of your paths are clear, because if you get up in the middle of the night or you have to go to the bathroom.
The damn dog is always putting things in the path.
And the cat intentionally tries to trip you. So, he just runs right in front of you. It's intentional. He's trying to kill us.
You have to be thoughtful about loving your brain, which means you love your feet so you don't fall. Some awesome things coming up. So Memory Rescue's out Tuesday. My new PBS special is going to start nationwide November 24th. My goodness, that's like 2 weeks. Right. So excited. I'm going to be in Atlanta and Miami and Baltimore. Someone asked about a clinic near Maryland. We have a clinic in Washington, D.C. and Reston, Virginia, right outside of Washington. What else is coming up? Our podcast.
There's always so much. I can't even keep track of you anymore. We're
doing 12 podcasts on Memory Rescue.
And people often ask, it's a very common thing. People say, if I can't afford to come in and get a full evaluation, what can I do? We do so much. We put so much. We know everybody can't come in. Is it, of course, seeing your brain and having a specific plan to you is awesome. It's optimal. But if, everybody can't. Our books are in libraries, right? We have our assessments online at amenclinics.com. We have our free podcast. My recipes are on my website. So we offer so much to help you get started. Anything you do along those lines is going to help you. So please take advantage of what we do offer for free. And
don't let your kids play football. It's just not smart. Your brain is soft. Your skull is hard. As Tana said, your brain runs everything in your life. You need to do everything you can to protect it. Okay. Love everybody. Have an awesome day.
Happy Veterans Day weekend.
Bye-bye.